It's Helen Farmer with you, Michael Bublé on Dubai Eye 103.8. And if you are listening and you're a man and you can't remember the last time you went to the doctor, this hour is for you.
Healthy habits.
On Afternoons with Helen Farmer.
We have an expert on hand to answer all of your questions about your health. Dr. Haluk joining us, consultant neurologist and andrologist from the Sheikh Clinic. That's part of Alpha Tame Health. He has got decades of experience, did his fellowship in andrology and urology at the Boston University Medical School, has published more than 55 papers in peer-reviewed journals, authored 10 books, and we have stolen him away from clinic to answer your questions this afternoon. Dr. Haluk, how are you?
Very well. Thank you very much, Helen. It's a pleasure to be in your show today.
Well, thank you for sharing your expertise. Before we've had a number of messages already. I do want to help listeners kind of narrow down what we're going to be addressing this hour. Can you tell us about your areas of expertise, so to speak?
Well, when you look at the medical institutions, there are a lot of female health places, but there are no men's health places that people can trust and go. And we at the Lutetia Clinic try to set up a men's health center where people can feel free to ask their questions, personal questions, confidentially, and get the proper answers and the proper treatments. There's an interesting study that is published in April 2021 that is actually made by an insurance company in U.S., saying that 45% of the men did not visit a family doctor or a general practitioner over the last year, whereas many women go regularly to their gynecologists to have their health checks before having any other symptoms.
So when you saw that research paper, that study, were you surprised at how few men are going to the doctor, or does this very much echo your experiences and stories you've heard?
This paper actually supports what we're seeing in the clinical setting, and just take in mind that this is made in U.S. and in a region where society plays a big role, like in Middle East. These numbers are actually worse.
I can imagine. To be honest, and I think the embarrassment factor is not to be underestimated. And unfortunately, when we're talking about things like male infertility or, prostate diseases, for example, getting that help early on can really make such a difference to diagnosis, to treatment and outcome. So we're going to try and push past that embarrassment factor between now and 4 o'clock. And if you've got any questions for Dr. Haluk, please do reach out on 4001. I wanted to ask you, andrology. Can you explain a little bit about what that is? I'm not really familiar with the term at all, Doctor.
Andrology refers to men's health. Andro meaning men, and logy is the science of men. Just like the equivalent of gynecology to men. These are organs that men have. That's the prostate, genital organs we specifically work on. And any of the diseases that these organs have to be addressed by an andrologist.
Okay, and that's what we're talking about this afternoon, so get any questions in. And you ladies out there, you can of course get involved too if you've got a question on behalf of your husband, male relatives, a friend, a son. And of course, urology, we are talking about men and women as well today, so please do reach out. 4001, you can get in touch using the ARN Play app. And don't feel like you have to put your name on it if you'd rather not, we totally understand. But if you would like a chat with Dr. Haluk, it is 04871 5500. We're going to your text next. We've had a message here, anonymous, saying, I seem to have a UTI 2 or 3 times a year. Sometimes I don't need antibiotics, just drink lots of water. But is this normal? We're coming to your messages next. It's Afternoons with me, Helen Farmer. It's all about your health. And please pick up the phone. You don't need to make an appointment. You just need to message us on 4001 if you're worried about any aspect of your health. Chaps, this afternoon, this is your time.
Join the conversation.
Talking health this afternoon, 45% of men did not visit a family doctor or GP for an annual checkup or wellness visit in the last 12 months. Do not be part of that 45%. Consult a doctor now. We've got one live on the show.
Healthy habits.
On Afternoons with Helen Farmer.
Delighted to have stolen away Dr. Haluk, consultant urologist and andrologist from Lutetia Clinic. He's live on the line until 4 o'clock. So get those messages in. Doctor, I hope you've had a coffee because you're going to be a busy man between now and 4. It is 4001 to message the show. You can, of course, use that ARN Play app, and you're more than welcome to leave your name off. Make up a name. Doesn't make any difference at all. I really just want to make sure you get the answers that you need. So let's go to the text line, Doctor. No name on this one, saying, I seem to have a UTI 2 or 3 times a year. In some cases, I don't take antibiotics, just drink lots of water and it goes away. Is this normal? The normal word. But 2 or 3 times a year, is that a cause for concern in men?
In men especially, yes. In women, we see it more frequently. The essence is that if you have an infection, please consult a doctor before running to antibiotics. Many of the symptoms are not actually due to a bacterial infection, so the antibiotics you take may not benefit from what you're experiencing. Especially in men, if you're experiencing problems when you pee, there could be problems with the prostate. There could be the sensation of the bladder might be overactive. Many other issues might be involved. So instead of running to an antibiotic, you should be consulting a doctor. In women, taking antibiotics also causes the relapse of the symptoms, because when you use antibiotics, you also kill one of the defense mechanisms in the body, which are the good bacteria that prevent the other bacteria to settle in and cause an infection.
Thank you. A worthy reminder there that just because they can be quite easy to get hold of, they're not necessarily the answer to all your problems. Now, I was wondering if we were going to get a vasectomy question, so buckle up, Dr. Haluk. P has been in touch saying, instead of me going on the pill until I go through menopause, I would like my husband to have a vasectomy. He doesn't want to chat about it, but I'd like us to visit a doctor. Ahead of our visit, I'd like to know when men can and cannot have a vasectomy. Any advice would be appreciated. What is the situation here in the UAE when it comes to having a vasectomy for, opting in rather than being necessary on a medical point of view?
Well, vasectomy is a choice. It is not a medical necessity in most cases. And the decision should be made by the couple, both of them. If the man wants to have a vasectomy and his wife doesn't want to have it, we usually don't. The same vice versa. Both of the couples need to decide on the procedure. It is a reversible procedure. So according to the UAE laws, it's not illegal to do the vasectomy. That's one thing we need to be sure of. The vasectomy is cutting the channel that carry the sperm to fertilize the egg so that the sperm production is not affected, but the sperm will not come out from the semen.
The delivery channel.
Yeah.
What about the procedure? What does that involve in terms of time, recovery, and even cost? I'm guessing it's not covered by insurance.
Unfortunately, insurances do not cover fertility-related procedures. It is a day surgery. It takes about 25 to 30 minutes. It's done under local anesthesia, and the patient can walk away the same day in a couple of hours. And it is not a major surgery. We don't cut many layers of the tissues, just a small neck about 5 millimeters on each side of the scrotum to get to the vas and just tie them up. The recovery is almost instant. After the surgery, there is an expected pain for a couple of days, which is not severe, and respond well to any kind of painkillers. And the important factor is that the protection from any pregnancy will start almost 3 months after the procedure, because we still have some stored sperm in our body that can impregnate the egg from a woman. So this is one thing we need to express, that having a vasectomy will not protect you right away from the surgery, and you need to still use some kind of protection for the next 3 months.
So is it a time thing rather than a number of ejaculation thing in terms of making sure we're clear for anyone listening who is perhaps planning this or they're planning on behalf of their partner?
What we do usually is after 3 months, we do a sperm semen analysis and see if there's any sperm in the semen. Once we're sure there are no sperms, then this procedure is effective, and we can tell the couple to stop using any other kind of protection.
Dr. Haluk, I wanted to come back to P's message here saying, is there any situations where men cannot have a vasectomy? Is there anyone who's not a good candidate for the procedure?
Couple of things. One of them is that if they still want to have a child later in their life, that's one thing. Medically, any contradiction to local anesthesia or any kind of anesthesia, some allergies or other medical issues might be the contradiction to vasectomy. But other than that, since it's a very simple procedure, there's nothing that will prevent from having it if you want to have it.
Men across the UAE crossing their legs right now, but no need, guys. We are here for you to help. If you've got any questions, we are here on 4001. Dr. Haluk, consultant urologist and andrologist at Lutetia Clinic, is with us until 4 o'clock this afternoon. We are going to your messages next. Anonymous message saying, is it normal for a man's libido to dip after recovering from COVID-19? Haven't heard that, but let's see what the doctor says.
On Afternoons with Helen Farmer.
Only on Dubai Eye 103.8.
Great to have you with us this afternoon. It is your free clinic, and chaps, this one's for you.
Healthy habits.
On Afternoons with Helen Farmer.
We're asking you to get in touch with any questions, any worries you might have, because Dr. Haluk is with us, consultant urologist and andrologist at Lutetia Clinic, and he's been answering your questions about UTIs, about vasectomies, and we've had many coming in on 4001, which I always find really interesting to see which doctors, which topics, which parts of the body tend to be popular. And I feel like because we are talking about things like urology, prostate, infertility as well, there's a huge amount of embarrassment or reluctance to go to a doctor about something like this initially. So you don't need to make an appointment. You need to pick up your phone, and maybe it's something we can help you with on the show right here, or maybe it's a case of giving you some more information so you can take that forward. Dr. Haluk, going to the text line. Wonderful to have you with us again. Thank you. We've got stolen you until 4 o'clock. A message here saying, is it normal for a man's libido to dip after recovering from COVID-19? I've heard of many aspects of long COVID. Is this something that's been flagged by any peer reviews that you've seen? Anyone coming into clinic complaining of something similar?
Both clinically and research-wise, a lot of studies and experience about post-COVID recoveries. We do experience a lot of libido decrease, maybe due to the hormonal changes and maybe due to the psychological effects of COVID itself. But it is proven right now that the testosterone level, which is responsible for the libido in men, is going down after COVID. It usually recovers and bounces back to normal levels after 3 to 6 months. But if you're still experiencing the same problems, you might need to visit one of a urologist or andrologist to check if there's any other underlying disease that might cause the problem.
Okay, it's the gift that keeps giving, this COVID, isn't it? Crikey, no body part remains unscathed. Going to the text line, as I said, 4001 to get in touch, and you can be anonymous, of course, or give us a call, 048715500. A and J saying, do you have any natural remedies for enlarged prostate? Anything come to mind there, doctor?
Well, there's a misconception about prostate. Prostate enlargement itself does not require any treatment. If the enlargement causes any obstruction for the urinary system and cause you problems, that's when we come into the place and try to give some treatment for the patients. The prostate is an organ, not a disease itself. It has a couple of diseases. One of them is enlargement due to aging after the age of 45, 50. Second is an infection of the prostate called prostatitis. And of course, thirdly, it's the prostate cancer. If you have any prostate problems, every man should be going to annual checkups for prostate cancer screening and any prostate symptoms they might have. Unfortunately, living a healthy life and any drug that is organic will help, but eventually if you have symptoms, you might need to use some medications.
That's really helpful in itself. Thank you, Doctor. No name, please, on this one, saying, does e-cigarettes cause erectile issues, and can erectile issues be reversed after stopping hormones used at the gym? Any insights there to do with, I'm guessing, erectile dysfunction caused by e-cigarettes and certain, well, hormones used at the gym, so I'm not sure how legal that is, but I'm not going to delve further.
All right, two very, very important issues. People think that the e-cigarettes are harmless. Unfortunately not. The nicotine levels in them are almost equal to the cigarettes themselves. So they cause a lot of vascular problems. When you have a vascular problem, you have problems with the intimate life itself. For hormones, we have to be very, 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 very careful. I can't emphasize enough. There's a mechanism in the body that regulates your hormonal production. That's usually in your brain. And brain senses the level of hormones circulating in your bloodstream. If you have enough hormones, it tells the testicles to stop producing more. So if you give any hormones from outside to the body, your brain will sense, okay, we have enough, more than enough, so let's keep the testicles stand aside. Don't work too much, don't need to produce more hormones. And once the hormones you give wear off, since you don't have an endogenous production of hormones, you will have a very decreased amount of testosterone in your body, and you will have experienced sexual dysfunction, muscular problems, even heart problems. And it is sometimes irreversible, since the tissues inside the testicles don't tend to work without a small push. So you might have constant problems thereon and might need to take the hormones for all your life. This is dangerous for both cardiovascular problems, neurological problems, as well as sexual problems.
Wise words indeed. Don't mess. Doctor's with us this afternoon to take your questions. As I said, consultant urologist and andrologist Dr. Haluk joining us from Lutisha. So please reach out if you've got any questions. This is flagging anything and maybe sitting at home on your car and saying, I really hope that Helen and Dr. Haluk talk about X, Y, Z. If something is on your mind, be the one to start the conversation. Get the answers that you need. It's 4001. You can be anonymous. We're having lots of messages with no names and requests for anonymity. It's absolutely fine. We certainly want to make sure that you're getting some reassurances this afternoon, and I know we are talking about parts of the body and issues that you might find a little bit embarrassing, and I can assure you, Doctor, I can guarantee you've seen it all and heard it all in your time in clinic.
Well, of course, that's my specialty. I've been working in this for more than 25 years now. And there's always something to learn, though.
As long as not one of those doctors who gets the students in, come on, have a look at this. I've never seen anything like this before while you're in the stirrups. No one wants that. Going to the text line. Can we turn our attentions to fertility? Because we have had a number of messages around this as well, Doctor. No name here saying, I suspect my husband has a low sperm count. Still convincing him to get tested. If he ever does, what does the test involve? How does it work? And is there a way to boost sperm count? Maybe a procedure or medication? There's no background here on why she suspects it is low. I don't know if they're trying for a baby, but do you recommend that men have a general idea of what their sperm count is like, or is it only really necessary if you are indeed looking to start or grow a family?
Exactly. We do not recommend routine sperm analysis. Only if you want to have a child, then, and you've been trying for more than a year without success, then we need to check for semen analysis. Of course, the sperm production can be boosted by several means. One of them being if there's an underlying disease such as varicocele, it should be treated first so that the tissues can work properly. And sometimes we can give some medicines that will boost the sperm production. But these are all dependent on what's underlying cause for the low sperm counts. Sometimes some of these low sperm counts may not be responsive to any treatment because they're congenital. Some of the tissues inside the testicles are congenitally less than they should be. But there are still ways with assisted reproductive system treatments, and the couples might have children after that.
And coming back to this message about what does a test involve, is that something that a guy would need to come to see you in clinic and it's give it the pot into the system, or is it something that perhaps could be done at home and then you deliver your specimen? Just trying to demystify this for anonymous listeners and anyone else thinking about it.
That's a very common question, Ellen. And unfortunately, patients need to be in the clinic because we have to analyze the specimen fresh. And we have timings between how the sperms act. So the sperm analysis needs to be in the clinic itself.
Okay, there you go. Sorry, I'm just we're going to come back to you. It is the last chance to get in touch with, we're talking about men's health this afternoon with the wonderful, the very knowledgeable, and just for a quick bit of reality check, Dr. Haluk is not briefed on any of the topics. Messages are coming in real time. He is just that good at what he does. Dr. Haluk, consultant urologist and andrologist, joining us from Lutetia Clinic. Up next, we've had a number of messages about the male menopause, and as an andrologist, he is the perfect person to ask what are some of the potential symptoms and what can all men be doing to make sure they are healthy and virile until the end.
Afternoons with Helen Farmer.
Join the conversation on Dubai Eye 103.8.
Coming up after 4 o'clock, I'm asking, do you believe in the law of attraction? Have you read that book, The Secret? And do you think by manifesting, whether that is through affirmations or a vision board, you can bring, your dream life to life? We're looking at that with Dr. Thrier after 4 o'clock today.
Healthy habits.
On Afternoons with Helen Farmer.
It is your weekly health clinic and we're having a bit of a men's focus today. Joining us live on Microsoft Teams is Dr. Haluk, consultant urologist and andrologist at Lutetia Clinic. He's been answering your questions on UTIs, low libidos and large prostates, trying for a baby. And we had a message earlier, Doctor, asking about the impact on erectile function from e-cigarettes. And a follow-up message here from another listener saying, can you please give some feedback on the effect of smoking shisha? You mentioned e-cigarettes have almost the same nicotine level as traditional cigarettes. What about shisha? Has that been known to affect erectile dysfunction? I mean, of course, we know lung-wise it's not the best.
Yes. Unfortunately, people who love shisha, they also are exposed to the side effects of the tobacco. Tobacco is used in both shisha and the cigarettes. They're harmful to the vascular system all the way through. And shisha especially is actually smoked for a very long time, much longer than just a single cigarette. So the effects might be even more than a single cigarette.
It smells nicer, but that's the only thing it's got going for it, unfortunately. Doctor, a message here from Lee saying, please help, I haven't been sleeping properly. My sister's a physician and says maybe it's the male menopause. Is that a real thing? Is this a symptom? I'm 45, thank you. Can you help out Lee and anyone else in their 40s, getting up to 50s, 60s, who might be noticing some of the effects of aging on things that had been previously pretty normal and pretty happy in their life? Male menopause, myth or truth?
Well, both, actually. First of all, the male menopause is not exactly the equivalent of a female menopause. The hormonal levels do not drop as steeply as the women experience. But the symptoms arise very quickly. And one of the symptoms is sleep abnormality. So actually our patient or the caller, I'm sorry for calling patient, might have some problems. But sleep is very, very complicated It has a lot of effects. Could be due to snoring, could be have some hormonal problems, could have some issues about psychology or the tiredness. Many factors affect the sleep quality and the quantity. So we have sleep specialists for that, and sleep specialists can see what the problem is with some tests. Andropause or male menopause, actually we don't use the term anymore. It's called male androgen deficiency syndrome now, and it is related to decreased hormonal levels, as well as if the normal levels are achieved but there are symptoms, the hormones may not be effective in the tissues. The reason being there are receptors that connects to the hormones for them to act, and these receptors may not connect to the hormones anymore. So for us to call someone with a decreased androgen, we need to examine not just blood tests, but also the symptoms. Mm-hmm. What are the symptoms? Well, you lose muscle weight. You have fatigue, your sleep might be disordered, you have usually depression, the libido is down, and you feel like you're always tired. And these symptoms, along with the blood tests, show us what we should be addressing.
And it can be addressed. This isn't something where you kind of go, okay, I'm 50 now, this is how I'm going to be until I die. There are lifestyle factors, there's things that you can step in as a physician to address as well. Dr. Haluk, we have run out of time. We haven't run out of questions. We'd love to have you back. It's been really fascinating to get your take on it and obviously help as many listeners as we can. Thank you so much. Really, really appreciate your time this afternoon.
Alan, thank you very much, because it is an issue that, along with us physicians, we need your support to make this a social problem, and people should understand that men also have difficult and different health problems, and they can be addressed.
Absolutely right. Zero embarrassment here. We can talk about prostates and erectile dysfunction all day long here on Afternoons with Helen Farmer. Dr. Haluk, really appreciate it. And you can find him at Lutetia Clinic. Up next, we're talking about the power of positive thinking. Do you think that if you put it out into the world, if you manifest it, that it will come back to you, whether that is your dream partner, your dream house, health or wealth? Or do you think it's a whole load of bunkum? 4001, Dr. Thoraya joining us after Christina Perry.